Hello, let's watch this video together, and afterwards I will break down the key things you need to know about the condition being described in the video.
What the doctor say?
No,
Let's know what
just
they say. You are doing what?
I'm lacking potassium.
You are lacking what?
Potassium.
Who? You are lacking bodabu.
Potassium.
Doctor say you are having bodabu. What kind of name is that one? I haven't heard before. Is it okay? Yeah. Is your wife? What the doctor is the problem?
Doctor complained that it's lacking blood, shortage of blood and potassium.
Are you a doctor?
No, the doctor says so.
Your wife say potassium. Potassium.
No, it's potassium.
You say what?
Potassium.
And you want to say potassium. What do you say now?
Potassium. Potassium.
Potassium.
He's lacking potassium.
Potassium.
Okay, the condition being described in the video is a medical condition where a patient have low potassium in the blood, and it is called hypokalemia. Hypokalemia is a medical condition where the potassium level in the blood is low. A number of things can cause hypokalemia, and they include poor diet, starvation. Poor diet and starvation, they are not common, but they can contribute to low potassium in the blood. Alcoholism, drinking of too much alcohol can cause low potassium in the blood. Vomiting, diarrhea, excessive use of laxative or laxative abuse can cause low potassium in the blood. The use of drugs like diuretics, example, furosemide, thiazide, they cause excessive urination, and potassium can be lost through this means. Renal tubular diseases, hypomagnesemia. When you have low magnesium in your blood, it can also cause low potassium in the blood. So in this case, you will have to correct the magnesium for you to be able to correct the potassium in the blood. Some drugs, again, like insulin, used to treat hyperglycemia, high blood sugar, can cause low potassium in the blood because it drives the potassium in the blood into the cell, causing low potassium in the blood. Beta agonists like salbutamol does the same thing. It drives potassium from the blood into the cell, causing low potassium in the blood. How do they feel when they have low potassium in the blood? Now, low potassium in the blood can affect the muscles, causing muscle weakness, tiredness, cramp, and in severe cases, it can cause paralysis where this patient cannot be able to walk. It can affect the heart, causing the fast heartbeat. It can affect the gastrointestinal tract, causing constipation and bloated stomach. It can affect the urinary tract, causing increased urine output. Now, how do we treat patients with hypokalemia or low potassium in the blood? First, we do a test called renal function test that can help us to dictate that there is low potassium in the blood. Afterwards, depending on the value of the potassium from that test and the severity of the symptoms, this can also guide us to treat. Patients with mild loss of potassium in the blood or mild hypokalemia, we encourage them to take potassium-containing food, especially banana. But other potassium-containing food or fruits include orange, beans, potato. But banana is mostly encouraged because it has a high potassium content. Now, if the patient have a moderate loss of potassium in the blood, in case of moderate hypokalemia, we give the patient tablets, oral potassium-containing tablets. They take orally, and when we're giving patients tablets, we also encourage patients to come back to repeat the test so that we will know the value of potassium after the treatment, because high potassium is also bad. High potassium is also bad for the body. Now, if there is severe loss of potassium in the blood. In case of severe hypokalemia, we give potassium containing drugs through the vein, which we call intravenous medication. Now, when we're giving these drugs, we give it slowly. As I said, high potassium level can be bad. If you give the drug rapidly, it can increase the potassium level, affecting the heart, causing cardiac arrhythmia, and the person can die from there. So when we're giving intravenous potassium containing drugs, we give it slowly through the vein as we monitor the heart. The main principle of treating hypokalemia is identifying the cause and treating the cause. If the cause is as a result of diarrhea, we give anti-diarrhea drugs. If it's as a result of vomiting, we give antiemetic drugs. If it's as a result of the drugs the patient is taking, example, as I said, patients on diuretics, patient on insulin, beta agonist, we can either stop the drugs or we reduce the dose of these drugs. Now, if the low potassium in the blood is a result of hypomagnesemia, we correct it, because if you don't correct the low magnesium in the blood, you can't correct the low potassium in the blood. So whenever your doctor says you have a low potassium in your blood, the best thing to do is to stay back and listen to him. He will tell you the best remedy for that condition. And when adequate treatment is given to you, your potassium level will come back to normal. Thank you for watching.